Well, Stefan, as we mentioned earlier, COVID takes a higher statistical toll on minorities in underinsured communities. Well, you don't have to tell that to the doctors who are staffing our inner city hospitals. News 4's Chris Glorioso has been chronicling the story of a Newark doctor who's been sounding the alarm about how COVID ravages poor neighborhoods.
In recent years, we've heard so much about inner city hospitals closing. Well, now there aren't enough beds in those underserved communities. At St. Michael's Medical Center in Newark, one doctor took us to the front lines of his battle to save the people who were already at a disadvantage.
The day is 3rd of April, 2020. I've been working about 12 hours.
Dr. Hamid Shaaban is a physician of color working in Newark, New Jersey, a city that's more than 80% minority. As the chief medical officer at St. Michael's Medical Center, he agreed to make a video diary, and one of his observations is the ruthless way coronavirus is attacking poor African and Hispanic Americans.
The viral pandemic is intersecting with two epidemics that are already taking place, and that includes the epidemic of homelessness and the epidemic of obesity.
Inside St. Michael's, nearly all of the 120-plus rooms are occupied by COVID patients. Everywhere you walk, you see IV lines snaking through cracked doors so nurses can adjust medications without getting too close.
Unfortunately, a lot of patients got intubated.
As of Tuesday, St. Michael's had 42 ventilators on site, 35 of them in use. That left just 7 available. And here, unlike many New York City hospitals, admissions are still rising.
It's tiring and it's exhausting, and it is a source of despair.
Working mostly on adrenaline now, Dr. Shaaban told us he is worried not just about the medics and the patients, but also about the rest of us. Doctors are supposed to be used to death.
I just got news that a friend of mine took his life because of some issues that he was dealing with related to this whole viral pandemic. That ultimately will be the story of this viral pandemic. Cases of depression, anxiety, psychiatric illnesses, and suicides.
Although St. Michael's Medical Center is still seeing hospital admissions rise, there is good news. They're expecting a shipment of new ventilators and also taking part in a program to administer the drug remdesivir, which is one of the potential treatments so many are hoping will pan out. Chris Glorioso, News 4, New York.